My mom's paying an extra $628.80 a year because she signed up late for Medicare. Don't let this happen to you. Let's talk about how and when to apply for Medicare so you don't get charged a penalty. Who qualifies for Medicare? What Medicare does and doesn't cover, the monthly costs of Medicare, plus some of the hidden costs, and my expert tips on how to find you the best plan. My name is Callie Navarese, and I'm a licensed insurance broker and certified Medicare expert. I help people across the country understand Medicare in a simple, easy to understand way. So, to qualify for Medicare, you have to be at least 65 years old and be a U.S. citizen or a permanent resident of the U.S. for at least 5 consecutive years. If you're under age 65, then you might be eligible for Medicare if you have certain disabilities or receive Social Security disability insurance for at least 24 months. And if you're already collecting Social Security because of a disability or retirement, then you'll actually be automatically enrolled into Medicare Parts A and B when you're first eligible. If you're not already receiving Social Security benefits, the easiest way to apply is online via the Social Security website, ssa.gov. Now, you should get a welcome packet of information mailed directly to you from Medicare a few months before your 65th birthday, because this is the start of your initial enrollment period, or IEP for short. Your initial enrollment period lasts for a total of 7 months, and this window starts 3 months before your 65th birthday, your birthday month, and ends 3 months after you turn 65. Unless you are still working and have health insurance through your job or your spouse's job, you should apply for Medicare during the 7-month window, because if you don't, you'll have to pay a lifetime late enrollment penalty. The penalty is added to your monthly Part B premium, and it goes up the longer you go without Part B coverage, and it never goes away. For every 12 months that you were supposed to have Part B and didn't have it, you'll pay an extra 10% more each month. Unfortunately, my mom signed up late for Medicare 3 years late, at age 68, and now she pays an extra 30% on top of the standard Part B monthly premium, which in 2024 is $174.70. This means my mom paid an extra $628.80 this year, all because she didn't sign up during her initial enrollment period. Now, you have two big decisions to make before your Medicare starts, and you can choose to stay on Original Medicare or switch to a Medicare Advantage plan. Original Medicare is Parts A and B. Part A is your hospital insurance, and that covers your inpatient hospital care, skilled nursing facility care, hospice care, and some home health care. Part A is free for most people because you paid Medicare taxes long enough while working. Part B is your medical insurance and covers your doctor visits, outpatient care, durable medical equipment, and vaccines. Part B's premium is $174.70 in 2024 for most people, and it's automatically deducted from your monthly Social Security. But this premium changes each year, and you'll pay more depending on your yearly income. If you stay with Original Medicare, you'll need to decide if you want drug coverage, which is Part D. They say Part D is optional, which technically speaking it is, but unless you have prescription drug coverage through your job or spouse's job, you'll be charged another late enrollment penalty. Let's say you delay enrolling into Part D for 6 months. Your monthly premium would be 6% higher for as long as you have Part D. In 2024, most people pay $34.70 a month for Part D. So this means you would pay an extra $2.43 per month. Now, Original Medicare doesn't cover everything and honestly leaves you with significant gaps in coverage. And I'm not a fan of Original Medicare because if you're hospitalized for just one night, you're going to pay $1,632 deductible. Services under Original Medicare must be medically necessary, and you have to meet your Part B deductible, which in 2024 is $240, before Medicare pays its share for services. You'll also pay 20% of everything you do medically, and there's no maximum out of pocket on how much you'll spend, unless you have supplemental insurance. Now, you can get extra coverage and additional benefits through a Medicare Advantage plan, which is also called Part C, or Medicare Supplement Insurance, also known as Medigap. Medicare Advantage is an alternative to Original Medicare, and it's provided through private insurance companies. These bundled plans include Parts A, B, and usually D, and you have to have Part A and B in place, and you still have to pay your Part B premium. That never goes away. Most of these Advantage plans have $0 premiums, and most have added benefits. These benefits vary, but usually include vision and dental and hearing coverage. These Advantage plans all have a max out of pocket, and this is what's going to save you, because remember, under Original Medicare, there's no max out of pocket. Just like how your employer insurance coverage or marketplace plan worked, you'll have copays, you'll have coinsurance, and you'll have networks. Many of you don't like to be told what to do, and I get it. And you don't like to be told where to go. So if that's not your style, this may not be a good fit for you. But if you don't have the resources to pay for the next option, then maybe Medicare Advantage is something that you have to do. There are ways to make this more risk-free, and we'll talk about those in another video. But just know, you can do things to reduce the kind of potential risk a Medicare Advantage plan leaves you. If you found this video helpful, please like this video and subscribe to our channel. We post videos with expert Medicare tips like this every week. Now, you do have a third option, and that's Medicare supplement insurance, which we also call Medigap. This is extra insurance you can buy from a private insurance company, and it pays what original Medicare doesn't. Medigap only works with original Medicare, though. The most common Medigap plans you hear of are letters F, G, and N. F is no longer available to those turning 65 today, so your two options are really G and N. By the way, I recommend after this, you look at the video we have about G and N. It's a really solid in-depth look into these two plans. If you choose to add a Medigap plan, what you do is you pick one of those two. Let's say you go with Plan G because it's the Cadillac of what you can buy. Then you would add a Medigap Plan G to your original Medicare. Again, you still have to have Part A and Part B and continue to pay your Part B premium of $174.70. That never goes away. So why would you do this? I mean, you're adding an extra cost to your world. These things can cost anywhere from $90 to $250 per month in some places. It can be even higher, but I'm not going to get into that. So you go out and you buy this thing. You pay your monthly premium every single month to an insurance company. Your only obligation further is to pay the Part B annual deductible, which is currently $240. And after everything else, you're done. You don't pay anything else. There are no networks. There are no copays. There's freedom. You're quite literally buying your freedom with these plans. Now, not everybody can afford to pay a Medigap premium, Part B premium, Part D premium, which is why Medicare Advantage is my favorite option for almost everyone. But if you can afford it and if you want it, you're paying for your freedom. You won't have to pay that $1,632 deductible I talked about earlier, because this G thing is paying that for you, because Medigap plans are designed to pay for the gaps left by original Medicare coverage. But in this option, you'll notice there's no drug coverage. You'll have to add a Part D plan. And the best time to buy a Medigap policy is right when you're turning 65, because you're in your Medigap open enrollment period. And you'll have 6 months after your Part B coverage starts to buy a policy. During this time, you can buy a Medigap policy even if you have health problems. Now, you can make changes to your Medicare plan later. October 15th to December 7th is your annual enrollment period. And during this time, you can join, switch, or drop a Medicare Advantage plan or a Medicare drug plan. And your new coverage will start January 1st of the next year. If you missed your initial enrollment period or you're in a Medicare Advantage plan, you can change to a different Medicare Advantage plan or switch back to original Medicare from January 1st to March 31st every year. And then you also have special enrollment periods where you might be able to join, switch, or drop Medicare plans if you have certain qualifying life events like moving or losing other health insurance. If you found this helpful, please like this video and subscribe to our channel for more expert insurance tips. And when you're ready, click the link in the description below to schedule a one-on-one consultation with me where we'll go over all of your Medicare options. And after that, you can check out this video right over here for more expert insurance tips. Thanks for watching, and I'll see you next time.